More Americans know their horoscope sign than their blood type. And that's a problem, because your blood type carries medically significant information about your risk of heart disease, cancer, diabetes, and cognitive decline that your horoscope absolutely does not. Your blood type is determined by a gene on chromosome 9, the ABO gene. That same gene influences how your body handles inflammation, blood clotting, and immune responses to certain diseases. Decades of large-scale epidemiological research, involving hundreds of thousands of people tracked over decades, has established clear statistical associations between blood type and specific disease risks. Today we are going through all four major types. One important note before we start. Blood type influences risk. It does not determine fate. What blood type gives you is context, and in medicine, context helps you ask the right questions and prioritize the right screenings. Blood type A. Blood type A is the most common non-blood type globally. And the research shows three consistent risk associations. First, heart disease. People with type A blood are approximately 5% more likely to develop coronary heart disease than type O. That sounds modest, but across large populations, it translates to thousands of additional cardiac events per year. The mechanism involves type A blood producing higher levels of von Willebrand factor, a clotting protein, and being associated with higher LDL cholesterol. Both contribute to arterial plaque and thrombosis risk. Source: Harvard School of Public Health, American Heart Association. Second, stomach cancer. The evidence here is particularly consistent across populations. The Shanghai cohort study, following over 18,000 men for 25 years, found type A individuals had significantly higher gastric cancer incidence. A Taiwan study of 339,000 people confirmed the finding. Type A blood was associated with a 38% higher risk of stomach cancer compared to type O. The mechanism involves H. pylori bacteria, the primary driver of stomach cancer, attaching more effectively to the antigens present in type A individuals. Source: PLOS ONE, Science Direct. Third, stress response. Type A individuals produce significantly higher cortisol levels in response to stress compared to other blood types. Higher baseline cortisol means elevated blood pressure, greater visceral fat accumulation, and impaired immune function under chronic stress. For type A, stress management is not optional self-care. It is cardiovascular medicine. Blood type B. Blood type B is less common in Western populations but significantly more prevalent in South Asian and East Asian populations. And the research reveals a specific metabolic vulnerability. The most recent and striking finding. A 2024 review published in BMC Medicine found that people with blood type B, both positive and negative, had the highest risk of developing type 2 diabetes compared to all other blood types. Blood type B individuals show lower glycemic control markers on average, higher fasting blood sugar, higher HbA1c. If you are blood type B, regular blood sugar monitoring starting in your mid-30s is a specific, evidence-based recommendation. Second, pancreatic cancer. Among all blood types, B carries the highest relative risk. Compared to type O, people with type B blood have a 72% higher risk of pancreatic cancer. This was confirmed in a study of over 107,000 people tracked since the 1970s and published in the Journal of the National Cancer Institute. Pancreatic cancer is called a silent killer, almost no symptoms until advanced stages. Awareness of the risk and prompt investigation of any unexplained abdominal or back pain matters. Third, cardiovascular risk. Type B blood is associated with an 11% higher risk of coronary heart disease than type O, and research shows elevated triglyceride levels in some B populations. Combined with the diabetes risk, type B individuals face a compounded metabolic vulnerability that makes diet quality and blood sugar control particularly critical. Blood type AB. Blood type AB is the rarest, only about 4% of the US population. And according to multiple major studies, it carries the most diverse disease risk profile of any blood type. Cardiovascular disease. Type AB has the highest coronary heart disease risk of all blood types, 23% higher than type O. Source: Harvard School of Public Health. The mechanism. Our blood carries both A and B antigens, producing the highest levels of both von Willebrand factor and factor VIII, two clotting proteins. Higher clotting tendency means higher risk of arterial blockage, stroke, and venous thrombosis. A 2024 Cleveland Clinic study found that of individuals who had COVID-19 had double the long-term cardiac event risk compared to type O. Source: Arteriosclerosis, Thrombosis, and Vascular Biology 2024. Cognitive decline. People with blood type are about 82% more likely to develop cognitive impairment than people with type O, according to a study published in Neurology. The pathway is vascular. The same elevated clotting tendency that damages arteries also damages the small blood vessels that supply the brain, reducing cerebral blood flow over time. Controlling blood pressure aggressively is the most important single intervention for type O brain health. Cancer. Type O individuals have a 51% higher pancreatic cancer risk than type O. The Shanghai cohort study found it was associated with 42 to 45% higher liver cancer risk. And Tufts University researchers note elevated risk for lung, breast, colorectal, and cervical cancers in non-O blood types including O. For type O, comprehensive regular screening is the most important practical step. Blood type O. Type O is the most common blood type globally, and in many ways, the most studied for its protective properties. The cardiovascular advantage of type O comes from naturally lower levels of von Willebrand factor and factor VIII, the clotting proteins elevated in A, B, and O blood. Lower clotting tendency means lower risk of arterial blockage, stroke from thrombosis, and deep vein thrombosis. In a large Iranian study of 50,000 people, non-O blood types were 15% more likely to die from cardiovascular disease than type O. Type O also carries the lowest risk of pancreatic cancer, the lowest risk of stomach cancer, and lower overall cancer mortality in major studies. But type O has two specific vulnerabilities. First, higher bleeding risk. The same low clotting tendency that protects against heart disease makes type O individuals bleed more significantly from wounds and surgeries. Surgeons sometimes require more careful hemostatic management for type O patients. Second, higher ulcer risk. Type O individuals have higher susceptibility to H. pylori colonization in a different pattern than type A, leading to higher rates of peptic ulcers. And H. pylori, over decades, is also a stomach cancer risk factor. The key message for type O: your natural cardiovascular and cancer protection is real. But do not use it as permission to neglect lifestyle. The protective advantage is statistical, not absolute. And it does not extend to the specific ulcer and bleeding vulnerabilities that require their own awareness. The bottom line: your blood type is one dial on a complex control panel. Smoking, diet, exercise, sleep, and stress are much bigger dials. But blood type is the one most people have never thought to look at. Now you have. Use it to prioritize the right screening conversations with your doctor, focus your lifestyle interventions where they matter most for your specific profile, and pass this information to the people in your life who share your blood type. See you in the next video.